The Heart Anatomy Lecture. This chapter of the heart, we're going to cover part 1 and part 2 in this lecture, where we're just dealing with the basic external and internal anatomy. The heart is the pump. It pumps blood. Most people are already clear with that. It pumps blood into two separate circuits at the same time. One side of the heart will pump blood into the pulmonary circuit so that the blood can get oxygenated. And then the left side of the heart will pump blood into the systemic circuit, which means it's out to the whole body. Vessels that carry blood away from the heart are going to be called arteries. Most of them are oxygenated. There are a couple that are not. Then veins carry blood back to the heart, these being deoxygenated except for the ones that have to do with the pulmonary circulation or the fetal circulation. Capillaries, we'll learn more about arteries, veins, as well as capillaries when we start the lecture of Unit 2 when we talk about the vessels in particular. This is just the general schematic showing the heart in the middle, sending blood to the head and neck and to the lungs. So you have the right side of the heart that's in blue. It goes down the right ventricle, and you can see it sends blood to the lungs so the blood can get oxygenated. This is one of those examples in the pulmonary artery where we have deoxygenated blood because it has not gone to the lungs yet. When the lungs have oxygenated the blood, we can see that it turns red. So it's now returning to the left side of the heart. So this is the pulmonary veins, and they are oxygenated. Goes down to the left ventricle, which we'll get to in a moment, and then out to the whole body. We have the representing the abdominal region as well as the lower body. So the position of the heart is such that it is under the sternum here, and the heart is not direct up and down with the apex. The apex is the pointy bottom part of the heart, and it lies over. So we clearly have the heart. It's set at an oblong angle where the bulk of the heart is going to be on the left side of the chest. You can see the positioning here, how it's below the sternum and the ribs and then in front of the vertebral column. The aorta goes across but straight to the back. So you can see how the aorta falls right next to the vertebral column for protection. Here's another view where we can see the front of the person here. This here is the aorta, and you can see how it actually goes toward the back of the person rather than the side. The basic anatomy of the heart, we'll cover the pericardium first. As you recall in 201, it's 2 layers. There is a visceral layer, and that layer is going to be the layer that's touching the surface of the heart. And then there is a parietal layer, and that is going to be the outermost layer. In fact, the heart is covered in the parietal layer when you first open the chest wall. You have to cut through that parietal layer just to see the surface of the heart. And then at that time, you won't actually see the visceral layer. The visceral layer is actually fused with the outer surface of the heart. A question regarding this may be what membrane surrounds the heart that you have to cut through in order to see the heart, and that would be the parietal pericardium. Another question could be something along the lines of name the serous membrane that is on the surface or adhered to the surface of the heart, and that would be the visceral pericardium. When you open the chest wall, you won't see the heart right away because it's covered in parietal pericardium. If you're a surgeon, you have to cut open this parietal pericardium just to expose the heart. What we see when we have an exposed heart are a number of features that you should be familiar with. The anterior most vessel here is going to be the pulmonary artery. That's coming from this right side of the heart and sending blood out that way. Then we have the aorta here. We have the superior and inferior vena cava. They are bringing deoxygenated blood into, this would be the right atrium. The pulmonary veins are on the back side of the heart. That is these guys here. In this view, we can see that this here is going to be the inferior vena cava, and this here is the superior vena cava. The apex of the heart is this bottom pointy portion. You can see that in this anterior view, as well as the apex being this on the posterior view. The atria with auricles. The atria is actually this enlarged portion. You can't see the other atria. This is the right atrium. The auricle is really not significant. The textbooks just mention it, so I include it here. This little sort of flappy, wavy edge. The flappy, wavy edge is the auricle of the atria. A figure here that I didn't include on here that you should know is the coronary sinus. That is this area, and all of the veins of the heart drain into the coronary sinus. We'll see here on the surface of the heart some coronary arteries. The coronary arteries are along the surface of the heart here and here. I'd like you to notice in this picture from a cadaver that it's actually in this sulcus, sort of like a ditch portion, and what normally happens is this is actually covered with fat. So the coronary arteries are covered with fat, and they sit in a slight indentation so that the pericardium that you actually can see here that normally lays over the whole heart will not impede with the coronary flow when the heart expands. We want to sort of have the fat covering it to temper some of those forces. The coronary arteries we now see are located on the surface of the heart. This is the sulcus. That means the little ditch that it's sitting in, surrounded by a fat pad or covered by a fat pad for protection. It brings oxygenated blood to the heart tissue, the working heart tissue, so the heart can work. If you have a blockage of a coronary artery, you're going to prevent blood coming to any muscle tissue distal to that point, and that's indeed what a heart attack is. The coronary arteries that you will need to know, first you need to know they come off of the base of the aorta. You have two that come off the base of the aorta. You have the right coronary artery, and you have what's known as the left main coronary artery. Just lift to the left here. The right coronary artery is going to serve the right side. You don't need to know the smaller branches. I have them listed because there are some smaller branches that feed different portions of the right ventricle. At this time, we just need to identify the right coronary artery. On the left side, you need to identify the left main coronary artery. We'll color these here. That in blue. So the left main coronary artery is going to be this in blue. Then in another color, we'll do the left anterior descending is the portion that's coming down the front of the heart. And then we will have yellow the left circumflex, and it's actually coming across, and it will literally rotate around the heart and serve the lateral and posterior side of the heart. The left anterior descending serves the anterior side of the heart, but specifically the left ventricle. The right coronary artery serves the right ventricle. When we color this, we can see how the circumflex is wrapping around the heart here. Get back here to the green. Left anterior descending is serving the anterior and mostly left side of the heart. The left main coronary artery is more of just a connector to go from the aorta and to get under this left atrium so that we can have the bifurcation. And then finally, we're back to the right coronary artery serving the right side of the heart and all of its smaller tributaries. Here's an angiogram where we can see nicely coming off of the aorta the right coronary artery as well as the left main, and then the left anterior descending as well as the left circumflex. The flow in the coronary arteries occurs during diastole when the heart is in the relaxed state. It is during this relaxed state that the heart is filling with blood. When the heart is contracting, not so much on the surface, but inside the heart muscle itself, because of the contracting, squeezing heart, it pinches off some of these smaller coronary arteries. So the musculature of the heart has a significantly reduced flow when the heart is contracting and ejecting blood. So the majority of blood flow that's serving the heart muscle is when the heart is in the relaxed state. There is a second reason for that. First of all, it was the stiffness and the squeezing of the muscle against the smaller vessels going into the thickness of the heart wall. The second reason why there's little blood flow in the coronaries during systole or when the heart is contracting is because the aorta lies here. Normally at rest, you have the valves that are located here, we'll talk about later, are closed. During ejection, these valves are open and they actually block and obstruct the hole that the blood would go through into the coronary arteries. For the cardiac veins, I have a number of veins listed. The only thing I really want you to know for your exam regarding the veins is the coronary sinus is a large, it's not even considered a vein because it's so large. It's on the back side of the heart. This view here is the front side of the heart, but showing the back sort of in a see-through fashion. So this here's the posterior view that I have it circled. The coronary sinus is where all the old blood from the heart drains into, and then it will deliver it directly to the right atrium so that it can go through the circulation and get back up into the lungs and reoxygenate. Here's a list of a number of cardiac veins. For the purposes of our Bio 202 exam, you'll just need to know about the coronary sinus. It's going to be in the posterior side of the part. It receives blood from all of our cardiac veins, and it's going to drain directly into the right atrium. The muscular layers of the heart, there are three. The outermost layer is on the surface. It's very thin and it's synonymous with the visceral pericardium. That's known as epicardium. The innermost layer, I'm going to jump way inside, it's going to be here or way inside of the chamber, and that is actually what's touching the blood. It's only a couple cells layer thick, it's inside the heart, and it's known as endocardium. The majority of the heart, the thick muscular layer, is known as the myocardium, is what the heart is mostly made up of. So as a recap, you should know about the pericardium, the two layers, that would be the visceral and parietal. The visceral is on the surface of the heart. It's synonymous with the epicardium. The parietal is the sac that the heart is actually contained in, and it obscures the view of the heart when you first open someone's chest. On the surface of the heart, if you were to just have a heart sitting there in a tray in front of you, you should be able to find the right atrium with the superior and inferior vena cava going in. You should be able to see the pulmonary artery, the aorta. You'll see either the pulmonary veins or a hole in the back of the left atrium where the pulmonary veins should be. You should be able to identify the apex of the heart, as well as being able to determine the anterior and posterior of the heart. Coronary arteries, you should know the left main coronary artery. The left anterior descending is serving the anterior portion of the left ventricle. The left circumflex is serving the lateral and posterior portion of the left ventricle, and the right coronary artery, which is serving the right ventricle. The cardiac veins drain directly into the coronary sinus. With regard to internal anatomy, we have 4 main chambers. The top 2 are smaller. They are known as atria. That's the plural form. We have a single right atrium that collects blood from the body. The right atrium, we have blood from the upper body as well as the lower body collected in the right atrium. Blood that has freshly been oxygenated coming from the lungs will collect in the left atrium. The blood from the atria will drop down into the ventricles. So we have a right ventricle and a left ventricle. The interventricular septum is what divides the 2 ventricles. When the ventricles contract and squeeze the blood in here in order to eject it out, we don't want blood to go back where it came from. So we have valves that will block any return blood. So it helps to maintain forward flow. We will talk about the valves in more detail coming up. In this image, we can see here's the right atrium. We see just a portion of the left atrium. There is an interatrial septum, which is not shown in this view. We'll back up here. This would be the interatrial septum. This here is the interventricular septum. The ventricles are represented here. We see this one in blue as the right ventricle because it has deoxygenated blood. We see this one over here in red because that is the left ventricle and it has oxygenated blood. So let's go into more detail with regard to the atria. Inside the atria has the arrangement of muscle fibers is known as musculi pectinati. The atria will contract and force blood down into the ventricles right before the heart in the early stages of the heart cycle. It is important for filling in elderly hearts. However, younger folks, it does not contribute a considerable amount to their cardiac output. It's known as the primer pump. So blood normally just falls straight into the ventricles. And when the heartbeat is initiated, the atria will contract first, pushing any remaining blood that's in the atria into the ventricles before this atrioventricular valve seals. So it's not a significant amount of blood, but it is important with regard to filling in elderly people. The right atrium is located here. This is a side cut from so it's a slightly different orientation that we had seen in the drawings earlier. Deoxygenated blood arrives in there from the superior and inferior vena cava into this right atrium. Inside the right atrium, we have a number of features, one being the fossa ovalis, which is a membrane that covers what used to be a hole in the fetus's heart. Musculi pectinati is the texture of muscle within the right atrium. I think we have some pictures here. So we can see, I don't have a picture where we can see the fossa ovalis. I have a diagram coming up. So we can see the arrangement of fibers right in that area. That is musculi pectinati. You can see that there. This is a much nicer view of the fiber arrangements within the right atrium showing you the musculi pectinati. So from this view, we can see the right atrium. Deoxygenated blood comes from the body via the superior vena cava or inferior vena cava. The deoxygenated blood also comes from the heart itself. That's where the coronary sinus opens into and brings the used up blood that had come from the coronary arteries. In the fetus, a hole known as the foramen ovale is between the right atrium and the left atrium. It allows oxygenated blood. Now remember, in the fetus, it got its oxygen from the placenta. So any blood coming back to the heart in a fetus is already oxygenated. Its lungs are basically the placenta. So it allows this already oxygenated blood to just cross straight over to the left atrium and then be able to go to the left ventricle and get pumped out to the whole body. After birth, this hole will close, and what happens is a small flap of skin-like tissue covers it, and it leaves a slight indentation, and that slight indentation is known as the fossa ovalis. You can see it in most heart dissections, but we don't always look for it in the lab. On the left side, this is where we get oxygenated blood. The oxygenated blood is coming in through our pulmonary veins and enters the left atrium. The features within here, you also see musculi pectinati. We can see some of that right here. It essentially is the other side of the fossa ovalis, although the indentation is more prominent on the right side, and we'll have 4 pulmonary vein openings. So the left atrium's here. It gets oxygenated blood from the lungs. We know it has musculi pectinati, and ultimately it's going to send blood down into the left ventricle. So now let's go through some of the details of the ventricles. The left ventricle is circular in its shape. It's more conical. The right ventricle attached onto the left ventricle, kind of like a back pocket of your jeans. The importance of these two shapes have to do with the biomechanics of how each side of the heart actually ejects blood out. For the sake of our class, those are some details that are beyond the scope of our class. But you want to notice that the heart is really built around the left ventricle. The left ventricle is what's going to send blood out to the body, where the right ventricle is going to send the blood out to the lungs. The right ventricle has deoxygenated blood from the body, from the upper body, lower body, arriving into the right atrium, and then travels across this right atrioventricular valve. When the right ventricle, so there's the valve, is ready to contract, we'll send it up and out and into the lungs. Notice that the wall, the outer free wall of the right ventricle, is very thin compared to the thicker outer free wall of the left ventricle. This is because the pressure in the lungs is so much less than that of the whole body, and the lungs are just adjacent to the heart, so it doesn't have to push the blood very far to get to the lungs, so it doesn't need as much strength. Other features that you'll see within the right ventricle are papillary muscles and chordae tendineae. They are accessory features to the valve. So we can see papillary muscles here and chordae tendineae are these stripes. We'll talk about these in a little more detail coming up. In this view, this is an actual picture of a heart. We have the right atrium here. Here's that tricuspid valve right here with chordae tendineae. And this here is the right ventricle itself. When it ejects blood, it'll come up and out, and this here is the pulmonary artery that's going to send it off to the lungs. The left ventricle receives oxygenated blood from the left atrium. It crosses the left atrioventricular valve, also known as the mitral valve, also known as the bicuspid valve. When the left ventricle ejects or contracts, it will send blood out the aorta and then out to the whole body via the systemic circulation. Inside the left ventricle, notice this basket weave pattern. That is called trabeculae carneae. It is also inside the right ventricle. We mentioned earlier that inside the atria, the pattern of musculature is called musculi pectinati. inside the ventricles, that pattern is called trabeculae carneae. We can see here is the left atrium, and this in here is the left ventricle. This here's the left atrioventricular valve, and the left ventricle, when it ejects, is going to send it up out the aorta there. In this view, we can see a very thick and prominent left ventricle compared to the right ventricle. So in summary, the chambers are on the right side. We have the right atrium. It's getting deoxygenated blood from the body. It will send it down into the right ventricle. The right ventricle will eject it into the pulmonary circulation to the lungs. It comes back from the lungs into the left atrium, which will drop it down into the left ventricle. When the left ventricle contracts, it pushes through this valve and sends it out the aorta to the whole body. The aorta is this one. So blood from the left ventricle is going to go up and through this aorta. It is oxygenated. This blood is heading out to the whole body. The first openings are the coronaries. They come off about here. This is for the right coronary. On the left side, it would sort of be behind this pulmonary artery, and it's going to come across here to about this point where we go down. So that's the left main. We have left anterior descending and the left circumflex. This is a pig heart, so we normally, if it was a human, there would be another branch sticking off here. The pig heart just has two. So normally you have 3 arterial branches. We can see the aorta here. Here's a closer view of the aorta. This here is the opening to the right coronary artery. The pulmonary trunk, blood from the right ventricle is going to push up into the pulmonary trunk. It's also known as the pulmonary artery. It goes through the pulmonary semilunar valve, and this is deoxygenated blood. So in summary, we see both atria receive blood either from the body, which is blue, or from the lungs, which is red. That blood travels down to the ventricles, into the right ventricle for the blue, left ventricle for the red. Then when the ventricles begin to stiffen and start to contract, these first set of valves, these atrioventricular valves, will close, so no more blood can enter, and the blood that is there cannot go back. The ventricles will continue to contract, pulling inward, pushing the blood out to the body or out to the lungs. The valves within the heart prevent backflow. So we have the left and so we have the right atrioventricular valve, also known as the tricuspid valve because there are 3 flaps. Then there is the left atrioventricular valve. It is also known as the bicuspid valve because it has 2 flaps, but is most commonly known as the mitral valve. We want to prevent blood from going back whence they came. The semilunar valves are at the base of the great vessels, namely the aorta and the pulmonary artery. The pulmonary semilunar valve is where blood pushes through when the right ventricle is squeezing and ejecting blood, opens that pulmonary valve, and then when the right ventricle is relaxing and filling with blood again, that pulmonary semilunar valve is closed. The aortic semilunar valve is pushed open by the force of the left ventricle pushing blood out to the body. When the left ventricle relaxes, that aortic semilunar valve will shut. Atrioventricular valves. This is written here as atrioventricular with a hyphen to emphasize its position between the atria and the ventricles. It is most commonly written as without the hyphen. Those valves contain flaps as well as papillary muscles down here, which attach to these strings called chordae tendineae. The strings are there to hold these valves in place. So when the ventricle is squeezing and blood is pushing up against these flaps, The strings hold them tight and prevent these from inverting. So the tricuspid valve has 3 flaps. It's on the right side. The bicuspid or mitral or left atrioventricular valve is on the left side. And again, here is the atrioventricular valve. The semilunar valves, we have the pulmonary on the right side and the aortic on the left side. Here's the semilunar valve. We can see that semilunars do not have chordae tendineae or papillary muscles. They are only the cusps themselves. You can see the cusps more clearly here. There's another view of the cusps when they're open. This one's not fully open, and this other one is almost all the way closed, but we can see these cusps as basins, and the more they fill with blood, the tighter the seal will be. Heart sounds are when our valves close. So it's important to know for every heartbeat we hear this lub-dub. And the lub-dub is sort of 2 reverberations that's coming. So if you put your hand on your heart, you can feel this sort of double reverberation. The first sound, lub in this case, is where the atrioventricular valves close. So first, blood is going to fill the ventricles. When the wall of the ventricles start to contract, blood's going to rise up and it actually catches in these cusps, causing these valves to seal shut and close. It is the slamming of those valves closed that makes the first heart sound. Then blood, while the ventricle is contracting, blood is being ejected out of the ventricles into the pulmonary artery or aorta. When the ventricles then go to relax and the pressure drops, blood starts to reverse but actually catches in these cusps, causing them to slam shut. That is going to be the second heart sound. This portion is more for your application of this information, but you will not be tested on the placement of the stethoscope. This is meant to show you in the green circles where the stethoscope would be placed to optimally hear specific valves. The valves are indicated here in these black oblong circles or these ovals. Here we can see towards the apex, you can more clearly hear the mitral valve without interference from the other valves. And likewise, on this side, you can hear the tricuspid valve without interference of the others. So even though the stethoscope placement is not anatomically correct, it makes it more acoustically ideal to hear specific valves. In this image is just showing you the heart sounds or reverberations that occur at the timing during a cardiac cycle, which we'll talk about in 2 more lectures from now, which will go over these graphs, but you can see the lub-dub or lub-dup as the 2 heart sounds. Abnormal heart sounds can occur when a valve doesn't close properly. They're called regurgitant valves. Or valves can get too rigid and then they don't open fully, and they will also make a sound. Abnormal heart sounds can also come from holes in the heart. The interatrial septum or the interventricular septum may have a remnant leftover hole from embryological development or inadequate closure of that fossa ovalis. And any movement of blood through those holes will also make a heart sound. These are some examples. You do not need to know this for your exam. They're just examples of heart sounds. The first one, obviously A, is normal. And so you can see that you don't normally hear sounds during this time, but certain specific pathologies would indicate that there's sound. So this is why listening to hearts is such an important diagnostic tool. So for review, you should know the chambers of the heart. Those would be the 2 atria and the 2 ventricles, where they're located, what their jobs are, and features inside. Features including musculi pectinati within the atria, trabeculae carneae in the ventricles. In the right atrium, we would have openings to the superior vena cava and inferior vena cava, as well as the coronary sinus, and an indentation for the fossa ovalis. On the left atrium, we would have holes in there for the pulmonary veins to bring blood back to it after it's been oxygenated from the lungs. You should know the pathway of blood flow through the heart, through the lungs, and then back to the other side of the heart. Which side of the heart has oxygenated blood? Which side of the heart has deoxygenated blood? You should know about the valves. We have the two different types of valves, 4 in total. We have 2 atrioventricular valves, one on the right and left sides. You should know all of the names for each of those valves. We also have 2 semilunar valves, a pulmonary semilunar valve and an aortic semilunar valve. And you should know their action during the cardiac cycle. This will make more sense, and we'll put these together when we do the cardiac cycle lecture. For the heart sounds, the cause is the closure of valves. The timing is the first heart sound being the closure of the atrioventricular valves, and the second heart sound is the closure of the semilunar valves.